Hello, healthy women. We are going to talk about polycystic ovary syndrome today. What is polycystic ovarian syndrome? It's a condition, it's a medical condition that causes enlarged ovaries and cysts around the edges of the ovaries. It's usually due to the abnormality in the hypothalamus-pituitary ovarian axis. That's the linkage between the brain and the ovary. The brain usually gives the ovary instructions to perform its duty. So when there's an abnormality along the pathway, then we have a lot of disorder occurring. And the major disorder that we have in polycystic ovarian syndrome is irregular menstruation and infertility. What are the effects of this abnormality in the ovaries, in the pathway from the brain to the ovary? We have a lot of abnormalities in terms of hormonal disorder. You would have heard about hormonal disorder. When there's irregular menstruation, we cannot control the time the menstruation comes. It can come irregularly. Some have it after every 35 days. The normal ovarian, the menstrual cycle usually occurs within 21 to 28 days. When you have women having menstruation cycle beyond 35 days, we call it oligomenorrhea, or they may even have amenorrhea when they cannot menstruate for up to 6 months. And so some women have menstruation twice a year, some 3 times, 4 times a year. All these conditions may be due to polycystic ovarian syndrome. Why do we call it a syndrome? When we have this hormonal disorder, there's a relationship with the insulin production in the body. And so we have insulin resistance. When there's insulin resistance, this can also affect the function of the ovaries. And then you have the woman having inability to control insulin. So if she cannot control insulin, she may have diabetes mellitus. When there's an increased sugar level in the blood, she can be prone to heart diseases. And the relationship with this abnormality in the hormones means that there will be reduced estrogen production, because there's hormonal derangement, and so we have plenty of male hormones in the blood where we have hyperandrogens. So when the androgens are too much in the blood, it will also lead to weight gain. The patient gains weight, and this weight gain is very difficult to control, despite all the measures we are going to talk about in controlling this polycystic ovarian syndrome. There's also excessive body hair growth and too much of pimples in the face that we call acne. So when you notice a woman growing mustache, growing beards excessively, and gaining weight, the weight gain is usually around the tummy area. When you have increased male hormones in the body of the female, there is also tendency to gain weight in the abdominal area. You notice when the men gain weight, is usually in the abdominal area. So when the woman also gain weight in the abdominal area. So when we investigate such women, we also check their lipid profile. We'll notice that they have high cholesterol in the blood. They also have high triglycerides and what we call sleep apnea. Sometimes when they sleep, there could be cessation of breath sometimes, especially in very obese women. These women are also at risk for endometrial cancer, or what we call uterine cancer. What is the cause of polycystic ovary disease? I told you it's a medical condition that leads to too much of cyst around the edges of the ovary. So it has been linked to genetic makeup, so it can be inherited from the family. So if a mother or a sister has polycystic ovarian syndrome, it can also affect the siblings that are female. If a male also have excessive hair growth on the body, it can also, be transmitted through the genetic pathway to the female daughters. So when we have such conditions, how do we manage it? First thing we'll do when a woman comes to the hospital, we check the body mass index. The body mass index signifies how the weight gain, how excessive it is. So if we have BMI that are 30 kilogram per meter square and above, it means this woman is already in the obese range, and so measures should be taken to reduce excessive weight gain. We can also do the waist circumference. I told you the weight gain is usually in the abdominal area. So when the waist circumference is above 35, then it means this woman has grown excessive weight. When she comes, after checking the BMI and the weight, and checking the blood sugar level, checking the blood pressure to see how much effect it has had on the body, then the treatment regimen, the first thing to do is to look at the lifestyle modification. Lifestyle modification in terms of the diet, what we eat, and exercise. Exercise to reduce weight. When a woman exercises, if she can reduce almost 10% of her body weight, and if it has reduced up to 10%, she will start seeing, regulation in her menstrual cycle. It can correct irregular menses. So weight loss is very important, and the best way to lose weight is to have an exercise that is up to 30 minutes in a day. So if you can put it into our routine that every day 30 minutes of exercise will help in reducing weight loss. And then we should take high fiber diets. If we eat high fiber diet and reduce processed food, a lot of processed food reduction will regulate the intake of food. And the best way to take food is not to eat big meals 3 times a day. Let's try to reduce the meals to small meals, like 5 times a day. So if we eat small quantity of food and you increase the time frame to like 5 times a day, then it will help in regulating the amount of blood sugar that is in the blood at the time of meals. I told you there's insulin resistance, so we usually also give drugs like metformin that will help to control the amount of sugar flowing in the system. So once we're able to control insulin, this will help to reduce the amount of testosterone and how the body uses insulin to also help reduce the weight gain. So we should also look at, we also give combined oral contraceptive pills, some hormonal drugs to help regulate irregular menstruation and also to help fertility. So for fertility, we give fertility enhancing drugs like clomiphene and other hormonal drugs to help control blood. If a woman is smoking, she has to quit smoking. She has to also quit alcohol intake and also regulate the meals that she takes. So once we do all this and seek help, let's seek help, because a lot of young ladies will have this depression from having irregular menses and inability to conceive. So once she seeks help, all these problems can be controlled. So we have drugs and we have lifestyle modifications that can be done to control the polycystic ovarian syndrome. So let's keep healthy and let's stay safe. Thank you.